Many women at some point hope to have children. However, gynecologic cancer in a young woman often threatens that fundamental goal.
The good news is that new fertility-sparing surgery may be an option for some young women with early gynecologic cancers.
Dr. Linus Chang, an expert in the treatment of gynecologic cancer, will discuss the advances in this field on this week's Health Talk.
We're up next.
Hello, I'm Dr. Eric Mazur.
And I'm Dr. Andrea Peterson. Our topic today is fertility-sparing surgical options in gynecologic cancers. Our guest is Dr. Linus Chang. He's the chairman of the Obstetrics and Gynecology Department at the Western Connecticut Health Network. Welcome.
Thank you very much for having me. It's a great honor to be able to speak to you, both of you, Eric
Well,
and
it's
Andrea.
an honor for us to have you.
Absolutely. So this is a really important topic, I think. So tell us a little bit about the history involved in trying to save a woman's ability to have children down the line should she choose to, even though she has a cancer today.
About 20% of a women are facing cancer diagnosis in their reproductive age group. And roughly 16% of these cancers are gynecologic cancers. So when they are facing a diagnosis of gynecologic cancer at their young age, in their reproductive age.
And we're talking about ovarian cancer largely for the folks at home, in terms of gynecologic cancer, or uterine cancer, or both?
Or cervical.
It could be
cervical.
also cervical cancer. So always the first question is, would I be able to have children in the future? Would this diagnosis mean that I have to have my uterus and ovaries removed? So yes, the standard of care to manage women with gynecologic cancer is to remove the uterus and sometimes tubes and ovaries. However, in certain early gynecologic cancer, one has the option of preserving the organs to allow women to have the possibility of future childbearing.
Now, is this relatively new? I know, again, as an oncologist and an old guy, most in the old days, we were just worried about cure. That was the dominant thought. And I guess now that we've proven that we can cure people using surgery, now we're starting to think about how do we preserve quality of life. I know this has been a big issue in Hodgkin's disease and some of the other malignancies. So tell us about the evolution of this a little bit. And is it safe to do that? I mean, again, are you sacrificing cure for potential fertility, or is it equally as good?
What you just said was so important. When we are exploring these fertility-sparing options, we really have to be keep in mind the most important thing is really survival. Even if you can spare the organs, but if you lose a patient, it just really means nothing. So when can we consider these surgical options, short of removing the uterus and ovary? And A, it has to be early, and B, we know which specific types. For example, I actually co-authored one of the first robotic surgery in treating women with cervical cancer. Was really fascinating. It was only developed about 10 to 20 years ago. So the idea is that when women have cervical cancer, the proper surgery is to remove the cervix and uterus. So in certain cervical cancer, when it's small enough, what I mean by small is smaller than 1 inch in tumor size without other spread, one can remove the cervix and the tissues around the cervix and then connect the uterus back to the vagina and preserving the uterus. Of course, these women will have to have cesarean surgery for their childbirth.
That's very interesting. So the uterus is still competent to hold that pregnancy without the cervix to sort of close it down, to hold it up there?
That is really smart. That's really the detail. We have to put it in the stitch, we call it cerclage, in order to close the cervix tight. Because if our cervix is removed, that's why the cesarean has to be done to deliver the baby.
Oh, I see. So that's very interesting. So you preserve. So there's still a hole there to allow menses to occur and everything, but it's not going to widen up at the time of surgery. You have to do the
delivery.
at the time of delivery.
So this is really pretty dramatic thing about removing the cancer and leaving the uterus behind, and we are doing that, and now gradually across the country, the many centers are doing this, allowing young women to have the ability to have children. But I just want to take this opportunity to remind everyone to really consider vaccination for your young children. That
I was just thinking that.
I was just going to interrupt you and say that.
Nothing is more important than preventing it, to screen for it, to come to your to go to your gynecologist to do regular screening. Because I hope that you don't have to go to this point.
Yeah, let's just emphasize that there is a vaccine now. I think hopefully people know about that at home. There is a vaccine now against the human papillomavirus, several types of it, that largely prevents cervical cancer. So this is a wonderful advance, but hopefully we won't need to use it because young girls, and they are young girls before they're sexually active, as well as young men, I believe, are now recommended, all should be vaccinated against this virus. And it prevents the cancer. It's amazing.
Right. Again, there's excellent evidence that the virus infection causes these cancers.
Absolutely.
And that that vaccine can prevent the cancers from developing.
Cannot agree with you more about young men. Not only that, you can decrease a woman from getting cervical cancer by preventing the young men to get HPV infection, but as a matter of fact, the head and neck cancer, the esophageal cancer, we are seeing more in young men, in men than women. So that stress the importance of
these are also
vaccination,
related.
HPV related.
Now, again, people have talked for years about, can we get a vaccine against cancer? We have one. Not against all cancers, but we have one against some pretty deadly, pretty common cancers.
Absolutely.
And we should, and the reason it's young people, maybe you could explain why do we say get them young and not wait till they're 40 years old?
Yeah, so the vaccination works by really stimulating our body to form the antibody. So if a young boy or girl has sex and infected with HPV, the virus, and they really have no ability to be generating the antibody now with this vaccine, it would not work.
They're already infected, and so it's too late.
It's too
late. So you want to catch the kids, young men, young women, before they're ever exposed.
Yes.
And that doesn't mean you're giving them a license to have sexual activity or anything. You're protecting them against cancer. I think that I can't feel strongly enough. This is a way we can prevent a couple of cancers. Don't smoke, get this. There are things we can do.
Yes.
And in that, again, you mentioned, but I want to talk again about screening, because you're talking about these cervical cancers where women can potentially have their uteruses saved and go on to have children, but those are for cancers that are detected when they're still very small. And the best way to do that is with screening.
Absolutely. Screening is so important. Screening even can detect pre-invasive disease, and it just can be treated very simply.
Before it becomes a cancer.
Correct. Before it becomes a cancer, you can just treat them in the office and they can be cured. So it can be really effective. I just want to turn your attention to what a increasing, very rapidly cancer in women in this country is cancer of the uterus. And why is that the case? Is because of our increased rate of obesity in our country. And endometrial cancer is a cancer, it's a direct result of weight. The more heavier a person is, the more likely the person is going to get endometrial cancer. And this can be a problem because we're seeing more and more young people are overweight, and so we are seeing more and more cancer of uterus in young women. Now, this is an area to say that we have options, not surgical, but medical options by treating with hormones, with progesterone, can hopefully these cancer regress. But clearly, weight control is very important.
And you can explain something. It's sort of interesting why fat tissue converts steroids in our body, naturally occurring steroids, to estrogens.
Absolutely.
And estrogens stimulate growth of the endometrial tissue of the uterus. So
Yeah.
obesity leads to that, just like exogenous hormones are a risk
Correct.
for
So-
hormone replacement therapy.
Only 20 years ago in the US, the incidence of endometrial cancer or cancer of the uterus was 30,000 new cases a year. Today, this year, is estimated to be 60,000, a doubling of this cancer. And we're seeing more often now in younger person. But there's fertility sparing options besides weight loss is to take either medication, the hormones, or IUD can reverse them to give a woman an option to have babies in the future.
Do they get a hysterectomy after they've had their children, or is it a permanent regression that they achieve?
Great point. We hope the woman can quickly have their pregnancy, and we still are concerned for the future outcome. Hysterectomy may have to be considered later on once they completed their childbearing.
Well, I didn't know that. That's really very exciting.
In many fields in medicine now, it really takes a whole team of doctors and other providers to take care of a patient and deliver the individual care that that person needs. Can you tell us a little bit about whether that's the case in young women with gynecologic cancers?
Yeah, thank you. Thank you for bringing that up. It's really vital. It's really not taking one person, as you obviously can see that the three of us are talking about important topic, and each one can really contribute and generate some important points. Managing cancer takes more than one doctors. We touch upon the vaccination by the pediatrician, the gynecologist, and the screening by gynecologists, and managing cancer by gynecologic oncologists like myself. And not only that, we rely on excellent pathologists, our team of medical oncologists, radiation oncologists, and I want to bring up, since you brought it up, it was a good point, is there is one thing that we really have to think about in young women and maybe men when they are facing a diagnosis of cancer, not just gynecologic cancer, but in other cancers. We're seeing even more frequently breast, lymphoma. You can consult a reproductive endocrinologist. There are options of retrieving your egg. Today, they can preserve your egg for many, many years. I think there was a report of an embryo actually preserved 20, 30 years ago, and she was born. It was successful.
And I just saw a paper saying that their success with frozen embryos is exactly the same as fresh embryos,
Absolutely.
which I found amazing.
It was only in the last decade that we are able to preserve an egg as successfully as embryo, and that really helped women in not have to determine, should I go and look out for sperm? Now you can preserve your own egg when you are ready for your family. You can find the right person to have the baby with.
And I think it's wonderful that medicine has evolved to a point where we are considering these other aspects of people's lives, that breast conserving surgery, cosmetics are important, pain after surgery, fertility, mobility. I just think it's a thrilling transition
Absolutely.
to I'm just going to take care of the disease and the heck with everything else, to I'm going to treat you as a whole person and think about these other important things in your life.
While we preserve and have the same survival, if not better survival.
Right, we don't want to
than in the
sacrifice.
past. Yes, that's really not sacrificing our patients.
And what a wonderful and hopeful way to end our show, because unfortunately we've run out of time. But thank you so much for all that important information.
Yes, thank you.
Thank you for having me.
Unfortunately, that's all we have time for today. Please do email us your questions and concerns to healthtalk@wchn.org. We'd love to hear from you.
And Andrew, I would like to thank our guest, Dr. Linus Chuang, for joining us on Health Talk today. Such a wonderful show.
Thanks so much for watching.